In the last financial year, cancer research spent £432 million on research. Over the next few years, the British Heart Foundation plans to fund more than £500 million of cardiovascular research. What it's like to go to air when you're having a mental health crisis. Approximately £115 million a year is invested on research into mental health in the UK. That means just £8 is spent on mental health research per each affected individual in a year. By some estimates, cancer research receives 22 times more funding per affected person a year. While cancer and heart research is of vital importance, with at least one of those conditions touching our lives in one way or another in our lifetime, right now, around 1 in 4 people in the UK is living with a mental health condition. That equates to some 15 million people with an illness that can turn their life upside down, affecting the well-being, relationships and their ability to work. For a huge number, mental illness can be a painful, exhausting and isolating experience, and for over 6,000 people every year in the UK alone, it results in suicide. MQ is one of the first major mental health research charities. They are currently aiming to research into improving understanding, improving current treatments and preventing mental illness. The vision is simple: to create a world where mental illness is understood, effectively treated and ultimately prevented. If you or someone you love is facing or has ever faced a mental illness, you'll no doubt be fully on board with that vision. The statistics highlighting the cost of mental illness to life, society, and the economy shows just how desperately mental health research needs a serious and sizable boost, fast. The economic and social cost of mental health in England alone is estimated to be over £105 billion annually, and the financial cost to UK business assessed to be around £26 billion every year, the equivalent to an astronomical £1,035 per employee, enough to cause any boss to break a sweat. It is clear from the figures alone that this is an unfolding crisis with high social and economic stakes that cannot be ignored. The research into mental health is just as vital as treatment and care, as it enables us to develop more effective treatments and understand why and how they work in a bid to reduce and even prevent mental illness across society. The lack of funding for research into mental health is also believed to be the reason that young scientists and academics are failing to show an interest or engagement in the subject of mental health. Anthony David, professor of cognitive neuroscience at King's College London, described the situation in 2015 as a catch-22, as the science cannot develop without more minds working on it. Stigma and discrimination, frustratingly, still exist around mental illness. And with it being harder to define particular causes, outcomes, and treatments of mental illness, it is often a challenge to show the impact that research can have to the public, which presents difficulties for fundraisers. However, with the increasing positive impact of campaigns to raise awareness around mental health, hopefully, we will see more funding being poured into this vital area of research sooner rather than later. More Winter is Coming, a flash guide to preparing for seasonal affective disorder. More what it's really like to be a patient in a mental health unit. More how to cope with mental health issues when it feels like the world is going mad.